how can we best treat eye bags? It's a question I'm asked all the time in clinic by my patients, and I think we have to go back to really looking at what a true eye bag is before we can determine the right treatment for it. Because people talk about eye bags and are actually talking about a variety of different things. Some people are referring to hollowness, some people are referring to water retention and puffiness, some people are referring to true eye bags, which are when the intraorbital fat pads herniate against the thin muscle around the eye and cause bulging underneath. And some people are referring to festoons or malar edema, which happen in the upper cheek thanks to fluid retention. So which treatment is appropriate very much depends on which of those things is happening in an individual patient. If the problem is hollowness, then often volume restoration using facial fillers or fat grafting are a good choice. It's always important to remember though that we need to restore the volume in the surrounding areas like the cheeks and the temples before we actually look at revolumizing a tear trough. If we're looking at puffiness, that can be quite challenging. There are some types of mesotherapy like the Light Eyes Ultra which can help to improve lymphatic drainage, or seeing a manual lymphatic drainage expert and having facial treatments that help to boost lymphatic drainage are good, as well as looking at lifestyle measures like how much salt you're eating and how well hydrated you are. If you have true eye bags, so where these fat pads are bulging against the delicate under eye muscle and skin, then we need to look at different options. So first of all, for many people, surgery at this stage is a good option. If you are prepared to consider surgery, often this will give you your best result and also your most long-lasting results. And people are often very pleasantly surprised when they realise how minimal the downtime for these procedures is in expert hands. If you are not considering surgery at this time, then you may be thinking what else can be done non-surgically. And through strategic facial fillers, we can achieve some good results. But this approach really has to start with fairly extensive structural filler through the cheeks, through the temples, working in different layers of the face to try and restore the tension in that delicate under eye muscle. And as we restore that tension, the under eye bag becomes less. And then we can sometimes refine with some delicate tear trough filler. If you have malar bags or festoons, they can be very, very challenging to treat. Manual lymphatic drainage again is a good option. If you've had facial fillers in that area before, it may be worth seeing an expert in facial fillers to consider whether they could be contributing and making the problem worse. For some people, surgical options like a lower blepharoplasty can again improve malar edema, but this really is dependent on expert oculoplastic assessment. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.